Okay, so you're pregnant, but you're also wondering, do I really need to put Botox or even something like microneedling on pause? What if I already had Botox before I knew I was even pregnant? Well, as a dermatologist focused on longevity and somebody who is in their second trimester of their second pregnancy, I totally understand and I get this question all the time. And today I'm breaking down what the science actually says, the risks, the unknowns, and what you can safely do instead. Hi, I'm Dr. Mamina. I am a triple board certified dermatologist, internist, and dermatopathologist with a special interest in how lifestyle and environmental factors shape skin health and longevity. On this channel, I share evidence-based insights to help you not just look good, but truly support your skin for the long run. If you're newly pregnant or planning to be, and you're trying to figure out what's safe and what's not, I've got you. I also did a whole other video all about pregnancy safe skincare, so be sure to check that out. I'll link it in the description box below. But today, let's talk Botox, like the absorption, the risks, what the research says, and also touch on other common in-office procedures like microneedling, lasers, and chemical peels. We're going to dive deep into what you actually should do if you're expecting. All right, so let's get into it. What is Botox and how does it work? So Botox is the brand name for botulinum toxin type A, which is a purified neurotoxin that temporarily relaxes muscles by blocking acetylcholine release at the neuromuscular junction. In aesthetic dermatology, we use Botox in tiny localized amounts to soften dynamic and static wrinkles. So wrinkles that you get when you're moving and then wrinkles that you have at rest. And it especially helps around the eyes, on the forehead, and between the brows. It's also FDA approved for hyperhidrosis or increased sweating in your armpits, as well as migraine headaches. Now there's a ton of off-label uses for Botox. We can use it for wrinkles for like the lips. We could use it for chin dimples. We could help turn like frown, lift it up a little bit. It can also be used to help slim your jaw by causing atrophy of your chewing muscles called the masseter muscles. And we could also use it near the jawline and on the neck to help define your jawline and get rid of necklines. Botox is honestly amazing. But Botox isn't the only neurotoxin on the market. There are a few other FDA approved botulinum toxins for cosmetic use. So I just want to make that clear. There's other brand names like Dysport, Xeomin, Jeuveau, and Letybo. Letybo, I would say, is the newest one to launch in the US. Each of these neuromodulators works in a similar way with slight differences in protein structure, diffusion, and onset, and sometimes even the duration. The more detailed differences between each of these neuromodulators is definitely something we should talk about in another video. But anyways, for the sake of simplicity, I will most likely be using the term Botox throughout the video just to refer to all neurotoxins, since that's the name that people most recognize. But know that I'm referring to this whole class of cosmetic neurotoxins or neuromodulators unless I specify otherwise. So what do we know about Botox absorption in pregnancy? So here's what the science tells us. There are no large randomized controlled trials on Botox use in pregnancy, and there probably never will be for ethical reasons. But here's what we do know from case reports and retrospective studies. So there was a 2006 review in Neurology that looked at 16 pregnant women who were treated with botulinum toxin for medical reasons, like cervical dystonia. Like this is for people who have certain muscular disorders in their body. I mentioned migraines, but I didn't mention that Botox is also FDA approved for certain muscular disorders on different parts of the body. So cervical dystonia is like on the neck. Anyways, when they looked at the babies of these 16 pregnant women who received medical Botox treatment, none of the babies had congenital anomalies. There was a 2014 review in the Toxins Journal that looked at Botox use for migraines and found no increase in miscarriage or birth defects. Now, there was a dermatology review that stated that while there's no definitive proof of harm, the data is still too limited to say that it's safe, so it's classified as pregnancy category C, meaning that potential risk does exist, but benefits may outweigh risks in certain medical situations. In terms of absorption, studies show that when Botox is used cosmetically and properly, it stays localized and does not reach significant systemic levels, and there's no strong evidence that it crosses the placenta. What about botulism from food poisoning during pregnancy? So you might be wondering, wait, isn't botulinum toxin super dangerous? Yes, when ingested in large amounts, like from improperly canned food, it can cause botulism, which is a life-threatening paralytic illness. But here's the key difference. Cosmetic Botox is highly purified and used in microdoses. In contrast, foodborne botulism comes from large amounts of unregulated toxin produced by bacteria that gets ingested and the toxins like made in the gut. Interestingly, there are actually no confirmed cases of birth defects from botulism poisoning during pregnancy. In one 1996 case report, there was a woman who survived botulism in her third trimester and delivered a healthy baby. So even in a worst case exposure, it seems that botulinum toxin doesn't easily cross the placenta. But again, that doesn't mean we give it the green light. Why we still avoid Botox in pregnancy? So if there's no proven harm, why do we avoid it? Well, because the absence of evidence is not the same as evidence of absence. So ethically, we take a better safe than sorry approach, especially during the first trimester when fetal development is most delicate. And in dermatology, we typically don't perform cosmetic Botox on pregnant patients, not because we know or think it's dangerous, but because we can't say with certainty that it's safe. And also, most clinics and providers have policies against it to medical liability and lack of FDA approval for use in pregnancy. It's an elective procedure. You're using it to treat wrinkles, which is not a life-threatening condition. Yeah, it's one of those things where you don't have to use it when you're pregnant. Anyways, that said, if you had Botox before realizing you were pregnant, don't panic. Based on current data, there's no evidence that a one-time treatment causes harm. What about other procedures? So let's touch on some other common procedures and whether they're pregnancy safe. First up, we have microneedling. So this one's usually avoided, even though it's not that invasive. It can definitely trigger inflammation like a wound healing response or pigmentation, and numbing creams are often used before microneedling. Numbing creams are not considered to be pregnancy safe. Also, here's my personal take, like with microneedling, you're creating controlled injury to the skin. So like I said, that means inflammation, you're creating some trauma and like a healing response. So I always ask, like, why would you use your body's resources to heal from an elective cosmetic procedure when those resources could be going towards making a whole human? Your body is already doing so much, so let's focus on that. Next up, we have lasers. So some low-risk lasers like Nd:YAG may be okay later in pregnancy. I don't even want to say that because we still really avoid anything that's unnecessary in the laser world. Also, when you have a lot of hormonal changes in your body, your skin can become more reactive and laser heat can be risky. Plus, if numbing cream is needed, which often is needed for laser treatment, like I said, many of those aren't considered pregnancy safe. And again, lasers work by causing controlled skin injury, just like microneedling. So I take the same stance, like you're creating inflammation that your body has to repair. Why not reserve your body's energy and immune resources for the amazing work it's already doing, growing your baby? All right, third, we have chemical peels. So gentle peels like lactic acid or glycolic acid under 10% are usually okay, but stronger peels, especially high dose salicylic acid or trichloroacetic acid like TCA peels, they're not recommended. Higher strength acids, and I'm talking like insanely high strength acids in animal models, did show birth defect. Number four, we have fillers. So just like Botox, fillers have not been tested in pregnant populations, so we avoid them out of caution. What can you do? So instead of injectables or lasers or microneedling, here are some ways to keep your skin glowing while you're pregnant. You can do facials with very gentle lymphatic drainage and massage and hydration. You could use pregnancy safe skincare like vitamin C, niacinamide, azelaic acid, bakuchiol. And then we have LED light therapy, particularly red light, though data is limited, so I would clear it with your derm first. Red light therapy, like on the face or the scalp, is not believed to affect birth outcomes, but like I said, we don't have studies. And again, check out my full pregnancy safe skincare video for a deep dive. It's linked in the description box below. Like, I really go into it. I talk about all the specific ingredients that you can use, the ones that you should avoid, where there's a little bit of a gray area. So to recap, while there's no strong evidence that Botox harms a pregnancy, we just don't have the data to say that it's safe either. So it's best to press pause during pregnancy and revisit cosmetic treatments postpartum. Now, if you're unsure, talk to your board certified dermatologist, especially the one who understands both aesthetics and the nuances of pregnancy skin changes. Now, in the postpartum period, there's also the whole breastfeeding situation, and that can potentially limit some of the things that you do as well. And I will have a whole nother video talking about what you can do postpartum if you're breastfeeding. If you found this helpful, please like and subscribe and share this with a mama to be who's wondering the same thing. Thank you so much for watching, and congrats if you are expecting.